Anorexia nervosa is a serious eating disorder. It is characterized by an intense fear of gaining weight. People with anorexia severely restrict their food intake, which leads to significant weight loss. Anorexia affects both the mind and body, and can be life-threatening if left untreated. It's not just about vanity or wanting to be thin, it's a complex mental health condition. People with anorexia often have a distorted body image. They may see themselves as overweight even when they are dangerously thin. This distorted perception fuels their restrictive eating habits. They may engage in excessive exercise to burn off calories. Anorexia can have severe consequences for physical health and can also impact emotional and social well-being. Understanding anorexia is the first step towards seeking help and support. Recognizing the signs of anorexia is crucial for early intervention. The disorder often manifests in behavioral, physical, and emotional changes. One of the most noticeable signs is dramatic weight loss. Individuals with anorexia may exhibit an intense fear of gaining weight. They may constantly weigh themselves or express dissatisfaction with their body size. They may also restrict their food intake, avoiding meals or eating tiny portions. Another red flag is a distorted body image. Despite being underweight, individuals may perceive themselves as fat. They may wear baggy clothes to hide their appearance. Physically, anorexia can lead to malnutrition and a range of health problems. These may include fatigue, dizziness, hair loss, and dry skin. Emotionally, individuals with anorexia may experience depression, anxiety, or mood swings. If you notice these signs in yourself or someone you know, it's essential to seek professional help immediately. The exact causes of anorexia nervosa are complex and not fully understood. It is believed to be a multifaceted disorder with biological, psychological, and social factors at play. Genetically, some individuals may be predisposed to developing eating disorders. Family history of eating disorders, depression, or anxiety can increase the risk. Psychologically, people with anorexia often struggle with perfectionism, low self-esteem, and a need for control. Traumatic experiences such as abuse or bullying can also contribute to the development of the disorder. Societally, the pressure to conform to unrealistic beauty standards can fuel body dissatisfaction and disordered eating behaviors. Certain professions or activities that emphasize thinness, such as modeling or ballet, can also increase the risk. It is important to note that anorexia can affect anyone, regardless of age, gender, ethnicity, or socioeconomic status. Understanding the risk factors can help raise awareness and promote early intervention. Seeking professional help is crucial for the effective treatment of anorexia nervosa. Early diagnosis and intervention significantly improve the chances of recovery. A comprehensive evaluation by a qualified healthcare professional is the first step. This typically involves a physical examination, a review of medical history, and a psychological assessment. The doctor will assess the individual's eating habits, body image, and emotional state. Treatment for anorexia is often multifaceted and tailored to the individual's specific needs. It may involve a combination of medical care, psychotherapy, and nutritional counseling. The primary goal of treatment is to restore the individual to a healthy weight and address the underlying psychological issues contributing to the disorder. A multifaceted approach: therapies for anorexia. Treating anorexia nervosa often involves a multidisciplinary approach, combining different therapies to address the physical and psychological aspects of the disorder. One of the primary forms of treatment is psychotherapy. Cognitive behavioral therapy, or CBT, is commonly used to help individuals identify and modify negative thought patterns and behaviors related to food, weight, and body image. Family-based therapy, or FBT, is another effective approach, particularly for adolescents with anorexia. FBT involves the family in the treatment process, providing support and guidance in restoring healthy eating patterns. In addition to psychotherapy, nutritional counseling is essential. A registered dietitian can help individuals develop a balanced meal plan to meet their nutritional needs and promote healthy weight gain. They also provide education on proper nutrition and help challenge distorted beliefs about food and eating. Navigating recovery coping strategies for anorexia. Coping strategies play a vital role in the recovery journey from anorexia nervosa. These strategies empower individuals to manage triggers, challenge negative thoughts, and build a positive relationship with food and their bodies. One effective coping mechanism is developing a support system. Surrounding oneself with understanding and encouraging individuals, whether family, friends, or support groups, can provide a sense of belonging and reduce feelings of isolation. Engaging in self-care activities is crucial for emotional well-being. This may include activities such as yoga, meditation, spending time in nature, or pursuing hobbies that bring joy and relaxation. Challenging negative thoughts and replacing them with positive affirmations is an essential aspect of recovery. Keeping a journal to track food intake, emotions, and progress can help individuals identify patterns and celebrate small victories. The importance of support. Support from loved ones is crucial for individuals recovering from anorexia nervosa. Family and friends can provide a loving and understanding environment that promotes healing. Educating themselves about the disorder is essential to provide informed support. Understanding the complexities of anorexia can help loved ones separate the individual from the illness. Active listening and validation are vital. Creating a safe space for individuals to share their feelings without judgment can foster trust and open communication. It's important to remember that recovery is a process, and setbacks are a normal part of the journey. Offering encouragement, patience, and unconditional love can make a world of difference. A hopeful future. Recovery is possible. Recovery from anorexia nervosa is a journey that requires time, commitment, and support. It is not a linear path, and setbacks may occur along the way. However, with the right treatment and support, full recovery is possible. The journey begins with acknowledging the presence of the disorder and seeking professional help. With early intervention and a comprehensive treatment plan, individuals can overcome the physical and emotional challenges of anorexia. Recovery is not merely about weight restoration, but also about healing the mind and developing a healthy relationship with food and body image. It's about rediscovering oneself beyond the eating disorder and embracing life to the fullest. Remember, there is hope, and recovery is within reach. Subscribe to our channel for more informative content.